So I was in the presidential symposium, which was genetic epidemiology at scale. So the mission was how we integrate genetics into epidemiology and ultimately translate genetic epidemiology into clinical practice. And we need to do that in very, very large numbers, potentially hundreds of thousands, millions of people. And so the session was about how we scale up in order to be able to get the results we need to be able to scale up to an even bigger population, which is everybody who gets health care.
In my talk at the Presidential Symposium, I described this rather bold plan to enroll 1 million or more Americans in a unprecedented cohort and follow them over many years, collecting information about their medical status, their DNA, their environmental exposures, and trying to understand what really are all the factors that play into health and disease. There's so much we don't know about what are the factors involved in health and disease. Our medical model tends to be studying people who have an illness. This is an opportunity to study a lot of people who don't. So one of the things I hope we'll learn out of this are what are the factors that actually allow people to stay healthy? What's resilience all about? We should learn a lot about that. I think we'll also learn, as we have 1 million people with very thorough analysis of their genomes and other things, how are there people out there who actually have in their DNA a glitch of some sort that you might have thought would have some negative consequences, and yet they seem to be doing okay? What does that teach us about the genome?
So as an epidemiologist, I'm often very, very focused on measurement of environmental and lifestyle risk factors. So I talk more about how we can integrate that with the genome and with some of the other biomarker-based analyses that we would have in a very large national cohort, for instance, and the importance of getting it right with respect to measuring environment and lifestyle. So I would hope that people understand that measuring environment and lifestyle is a critical part of an electronic health record, that a lot of the information that we often treat as research data actually qualifies as being clinically relevant, and collecting it in a standardized way and then feeding it back into the clinic has an immediate virtue, as well as creating a much larger database than we currently have about people's lifestyle habits, their environmental exposures, their family history. A lot of that information is quite valid and much more useful than I think audiences in genetics typically understand.